Hello and welcome to Medical Dialogues. I am Dr. Bhumika and here is what I bring to you from the world of medicine. Combination immunotherapy shows increased survival and antitumor activity in bladder cancer cases. Findings from the international 4-2 clinical trial showed that a combination treatment, including immunotherapy, is safe and tolerable in patients with locally advanced or metastatic bladder cancer. The results, which were recently published in JAMA Oncology, show potential to broaden the number of patients with bladder cancer who could benefit from immunotherapy, an approach that harnesses a patient's own immune system to fight cancer. The tumor microenvironment plays a critical role in predicting response to immunotherapy. Tumors with a T-cell-inflamed microenvironment, which are characterized by infiltration of CD8 T cells, chemokines, a group of proteins that help in migration of immune cells, and an interferon signature, respond well to immunotherapies and are associated with improved survival. In urothelial bladder cancer, increased T-cell infiltration has been correlated with longer patient survival. In 2016, we published studies showing that the tumor with FGFR3 mutations have no T-cell infiltration, which led to the logical conclusion that blocking the FGFR pathway could make more patients responsive to immunotherapy, said Swiss. In preclinical cancer models, the combination of FGFR inhibitor and a programmed cell death ligand 1 inhibitor showed increased survival and antitumor activity, suggesting clinical utility of this combination. It is the first clinical trial to evaluate the safety, tolerability, and the recommended phase 2 dose of FGFR inhibitor plus PD-L1 inhibitor in advanced urothelial cancer patients with FGFR mRNA high expression. The study enrolled and treated 37 patients between May 15, 2018 and July 16, 2021. By measuring FGFR mRNA gene expression, we found that half of the patient's tumor have activation of the FGFR pathway, whereas previous studies reported only about 15% using a method that measured only FGFR DNA mutations, suggesting overexpression of FGFR captures all mutations and additional tumors where this pathway is relevant, said Swiss. In previous studies, the response rate reported was 23% with PD-L1 inhibitor atezolizumab alone and 21% with regorafenib alone. However, by combining the FGFR inhibitor and PD-L1 inhibitor, the responses rate increased to 54%. In addition, the responses were achieved quickly with a median time to response of 2.1 months and included many durable responses lasting longer than 2 years. Despite negative expression for PD-L1 and lack of FGFR3 gene alteration, in most patients treated with combination therapy, the objective response rate in this subgroup was 53%, indicating that positive therapeutic effect was not dependent on PD-L1 expression of FGFR3 gene alteration status. The next generation, more selective FGFR inhibitors are being developed, which should improve tolerability, and combining them with PD-L1 inhibitor may yield better results with fewer side effects, said Swiss. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.